Good afternoon, Ms. Jones. My name is Michael. I'm one of the nurses here at St. Michael's Hospital. Thank you for being a patient with us. You're being discharged with a diagnosis of heart failure, which is an ineffective pump. Often leads to edema and retention of fluid in the body that makes it hard for the heart to work, and it lowers your cardiac output. And so we're going to give you some medications to try to improve your cardiac function. Those two medications are metoprolol and Lasix. I'm going to do a one-on-one instruction with you and teach you about these medications, and then afterwards I'm going to ask some questions and have you answer those questions on the medications, so that I'm sure that you understand these medications, why you're taking them, and how often to take them and how much, so that we can try to prevent a rehospitalization or exacerbation of heart failure. That's what we're looking out for when you get discharged with this diagnosis of heart failure, is that we're trying to prevent you from being rehospitalized within 30 days. That's one of our goals. So the first medication that we have is the metoprolol, or the beta blocker. This is going to lower your heart rate and lower your blood pressure, but this is a medication that's often utilized for the indication of heart failure. You're going to take 25 milligrams of metoprolol once a day for 2 weeks. The next medication is going to be the furosemide, or the Lasix. You'll probably recognize it by the name Lasix. It's a diuretic. It's going to make you pee. It's going to help reduce the fluid volume in your body so you don't have the exacerbation of the heart failure. So you're going to be taking the Lasix, again indicated for heart failure, 40 milligrams twice a day. Looks like around 8 a.m. and 2 p.m. is how they have it scheduled on your medication bottle. Ms. Jones, I'm going to give you the medication bottle and have you answer some questions about the medications for me. Can you tell me the name of that medication, ma'am?
Lasix.
And can you tell me for what reason or what diagnosis you're taking Lasix for?
Heart failure.
And how much is each dose of Lasix you're going to take?
40 milligrams.
And when are you going to be taking it?
Twice a day. 8 a.m. and 2 p.m.
Perfect. Keep in mind that Lasix does have some side effects. We're going to be looking out for dizziness, weakness, and some muscle spasms that could be associated with electrolyte imbalances, because the Lasix can affect your potassium. So that we'll be looking out for. And then you have the other medication. Can you tell me the name of this medication?
Metoprolol.
Okay. And for what reason or what indication are you taking this medication?
Heart failure.
How much of this medication are you going to take in each dose?
25 milligrams.
And when are you going to be taking it?
Once a day.
Perfect. Thank you. Again, keep in mind, metoprolol will also have some side effects that you'll be on the lookout for, and that will be dizziness, also low heart rate and low blood pressure. So we're going to be doing frequent blood pressure checks at home with this medication, and keeping a check on that, looking out for, again, dizziness, low heart rate, and low blood pressure with the metoprolol. Well, I'm real happy with your performance in the question and answer session after the one-on-one education on the medications you've been prescribed for heart failure. So you did successfully do that, so I feel comfortable that you'll be successful with your medications, and we'll probably be preventing you from coming back to the hospital within 30 days, which again was our goal with the heart failure diagnosis, is to prevent rehospitalization for 30 days. And if you do have any questions, feel free to reach out to your primary care provider, and again, be aware of the side effects that will be listed in the materials that you receive with the medications when you fill those prescriptions. And good luck with your treatment, and I hope everything works out for you, Ms. Jones. Thank you again.
Thank you.